After 40 years, no one should still be dying of AIDS. No one.
We can be the generation that brings about an end to HIV.
HIV is a social justice issue.
It's also one of the leading causes of death for women in their reproductive years, so it's as well a women's rights issue.
A lot of homophobia is rooted in the stigma that came from the AIDS crisis in the 80s and 90s.
What is exciting to me about amfAR is from its somewhat humble beginnings of around $250,000, we have provided over $600 million for research, for education, information, advocacy, and the bringing together of people from all over the world to try and bring an end to this global epidemic.
We're incredibly proud of what amfAR has been able to achieve over the past 40 years. Our impact can be measured in millions of infections prevented and countless lives saved.
40 years of AIDS research has brought incredible achievements, and I'm proud that amfAR has been on the vanguard of many of those.
amfAR's role has been to try to fund very exciting cure research that typically wouldn't be funded by other agencies. The scientific community is very much aware that amfAR is a key funder of HIV cure research.
We've had a long history of producing work that has an impact on both domestic as well as global HIV.
Treat AIDS is a program of amfAR. We've changed our focus and shifted it more towards issues of mental health and substance use, which are increasingly bigger challenges for people with HIV.
The biggest priorities is funding for domestic HIV as well as funding for global HIV and funding for HIV research.
The field of HIV is this incredible mixture of science and human rights. We are constantly getting new medical breakthroughs, new scientific breakthroughs, and those are brought to scale by activists who are working hard to protect rights and to make those breakthroughs a reality for people. I'm pleased to be able to sit at the nexus of those two, really working in science and activism.
AIDS research and all sorts of funds raised to support people that are living with HIV/AIDS, it's all important. It always has been important.
The biggest challenge amfAR faces is the perception that AIDS is cured or behind us.
I think that a lot of people are not aware that the AIDS, the HIV pandemic, it's still a public health crisis and still very deadly, very serious, and we're still searching for a cure.
We cannot and we will not settle for anything other than an end to AIDS.
What amfAR I think is really great at is really funding the right research.
And with your help, I believe we will have a cure, and we'll have it in our lifetime. So help us. Let's make AIDS history.